Hi, this is Dr. Rogu from RBK Pediatrics and Urgent Care in Comac and in Bayshore. Today I'm going to speak to you about the COVID vaccine in the younger child, 5 to 11. We're all excited to hear that it was finally approved by the FDA for emergency use authorization, and soon we will be giving this vaccine to a population of these children. So let me share the PowerPoint presentation with you, and let's begin. So COVID vaccine in the 5 to 11-year-old child. What do I need to know as a parent? There were some recent approvals and future plans for the COVID-19. On October 29th, 2021, the FDA authorized the emergency use authorization for the Pfizer vaccine for children 5 to 11 years of age. That was based on the FDA's thorough and transparent evaluation of the data that they had from the millions of doses of other vaccines that were given over time in the younger children 12 and above, in adolescents, and some adult information. They also took some input from different advisory panels and committee experts, and then they all overwhelmingly voted in favor of making this vaccine available to the younger children in order to end this pandemic. It is not fully approved by all organizations and it is not being given yet. So please, this is just an informational video. We will start giving the vaccine once it is fully approved by the Centers of Disease Control, the CDC, the ACIP, and American Academy of Pediatrics. Once all this happens, then large-scale vaccinations will begin. We will not be taking appointments yet for this because the last thing we want to do is book appointments and then find out that we don't have the vaccine on site yet. But as we have already been doing, you can rest assured that RBK will be giving these vaccines on the weekends in Comac on Saturday afternoons and in Bayshore on Sunday mornings. We might have to expand some of that accessibility depending on the need of the vaccine. RBK has already been approved as a vaccine center for pediatrics 5 to 11 years old, and we had placed an order and we were approved for it. We just don't know when it will be distributed to our office. Now, some key points for parents and caregivers. The vaccine, as we all know, is very effective. The vaccine has been found to be 90.7% effective in preventing the COVID-19 illness in children 5 to 11. And the immune response for these young children has been comparable to those of the older adolescents. The safety of this vaccine appears to be very safe. They studied 3,100 children between the ages of 5 and 11, and no serious side effects have been detected or reported. Next week, it is our understanding that the CDC should be meeting to discuss further details and recommendations for this vaccine. But usually what happens with these vaccines, it starts with the FDA, moves on to the CDC, then a couple of other advisory committees. And once they all agree, then it'll be full vaccination. Now, I want to tell you a little bit about the RBK experience with positive rapid COVID tests. We have seen quite a few positive COVIDs in the RBK universe. Beginning September 2020, when we started doing the rapid COVID testing, we had performed 13,118 tests. Out of these tests, 794 children were positive. Now, I don't know if they were sick or if they were traveling or they were just exposed. It's a mixture of everything. But that gives us a 6% positivity rate over time, which is consistent with what we're seeing in the news. Now, some side effects that are found with the COVID vaccines, they're similar. It will be similar in the children as it is with the younger adolescents. Most of the symptoms are mild to moderate. They occur a couple of days after the injection and usually go away with supportive care and almost always occur after the second dose. Now, some of the commonly reported side effects in these children are pain at the injection site. Who didn't get a COVID vaccine and get pain on the site? You got some redness and swelling, tiredness, headaches, maybe some muscle and joint pain, chills, fever, swollen lymph nodes, maybe a decreased appetite in children. I personally got my COVID vaccine given by one of my nurses. It was painless. The next day I had some pain at the injection site. I had a little bit of tiredness, a little bit of chills at nighttime, a little swollen lymph node, and then everything went away within a matter of hours. So I think I'll deal with the vaccine side effects as opposed to getting the COVID vaccine because that's not fun. I had seen plenty of children that were positive, and I've seen a personal friend that was sick with the COVID vaccine, with the COVID illness. No risk factors. The only problem was that she did not get the vaccine in time, and that's why she got sick. Now, the risk of myocarditis is a hot topic for a lot of people. People are afraid of myocarditis, which is an inflammation of the muscle around the heart or the little film around the heart. It was discovered and may have been associated with the COVID vaccine in the older children. They observed this risk. It was highest in males 12 to 17 years of age, occurred after the second dose. Then the FDA did its own risk-benefit analysis where they compared the vaccines to the assessment of how many children were hospitalized, what was the mortality rate, and they came to the conclusion that the risk of the disease is far worse than the risk of the vaccine when it comes to myocarditis, which means there's a better possibility of somebody getting myocarditis if they catch COVID-19 disease than it does for if they got the vaccine. So I can tell you that in our RBK practice, we have not seen the secondary effects of myocarditis after the vaccine. Now, what is the current plan for the COVID clinics at RBK? We are, as you know, already giving the COVID vaccines on the weekends to patients 12 and above, to friends and family of RBK Pediatrics. We have the Pfizer vaccine, and we have a limited supply of the Moderna vaccine. Making an appointment is rather simple. Just go to the rbkpediatrics.com website and click the bubble in green that says schedule appointment, and pick Saturday or Sunday. And then you'll fill out the form that, put your name, your age, is it your first dose, is it your second dose? There will be some specific form for the 5-year-olds. And once we get the vaccine physically in the building, we will begin making the appointments. We will not make appointments until the vaccine is physically here. The last thing we want to do is, schedule a whole lot of appointments like they did back in January and February of last year, and discover that there's no vaccine, and we blame it on the state. So once we get a tracking number that the vaccine's en route, then we'll open up the portal for people to make appointments, and we will have appointments, so have no fear. So as usual, RBK has been here at the forefront of, the COVID pandemic. We've always done the right thing by our patients, and we will continue to do the right thing moving forward. Thank you, and thank you for trusting in RBK Pediatrics. This is Dr. Rogu signing off.